I must clarify, thank you, Mr. Senate President. I must clarify that IRM is not specific only to COVID-19 pandemic, as it is based on the provisions of the National Health Insurance Act and the UHC Act that gives PhilHealth the flexibility to implement financing mechanisms to ensure provision of benefits for Filipinos. This scheme has been in place for many years and was relied upon during the Ondoy calamity, Yolanda, and even the Marawi siege. On January 30, 2020, the board allocated IRM for the immediate payment of 50% of all pending good claims in the province of Batangas in response to the Taal volcano eruption. Naturally, the national state of calamity and the state of public health emergency due to COVID-19 pandemic compelled PhilHealth to make the IRM available for HCIs, consistent with the Bayanihan to Heal as One Act. We are in a war against an invisible enemy, and COVID patients are not the only casualties in this war. IRM funds are not exclusive to hospitals catering to COVID-19 patients. It is for all HCIs caring for all patients during this pandemic. It provides prepayment for hospitals to address the increased burden to them and cushion the impact of the pandemic to their capacity to ensure continuous provision of care for Filipinos. The scope of IRM releases cover all HCIs given the nationwide state of public health emergency brought by the pandemic. 17% or 711 out of the 4105 of HCIs received the IRM and 14.9 billion out of 27 billion was released. On the allegations of palakasan system in the release of the IRM, we assure you there is none. For PhilHealth benefit packages for SARS-CoV-2 was conducted in March. The basis for PhilHealth. And at the time this package was introduced, there were only 6 laboratory testing facilities and 4 RT-PCR test kits. When revised, there were 34 laboratory testing facilities as of May 24 and 41 RT-PCR test kits approved by the FDA as of May 19, hence the need to recalibrate. We continue to conduct studies on the testing packages as we ramp up our testing capacity and widen the catchment areas of our laboratories nationwide so that PhilHealth can leverage on these efficiencies in its costing. On the reversal of final and executory judgments of the courts on the suspension orders imposed upon erring and fraudulent HCIs. As reported to the Blue Ribbon Committee and Committee on Health and Demography last year, the board considered many factors before it made the decision to compromise on the manner by which the judgments are to be serviced. The said decisions were made upon the advice of our legal on the latest jurisprudence and applicable laws, including the exceptions on the execution of final and executory decisions to serve substantial justice and equity, such as providing immediate healthcare services by imposing the maximum penalty in lieu of suspending a hospital's operations. Upon my instructions, the corporate secretary reported to the appellate courts concerned on the board's decision on the best means to execute the judgment. Mr. Senate President, I respect the Senate Committee of the Whole's unflinching fight against corruption. In the same way, I remain unflinching in my battles, not only in the fight to protect my character as a public servant, but also in the fight to implement President Rodrigo Roa Duterte's noble vision for genuine universal access to health care for all Filipinos and ensure we come out of the pandemic healthy as a nation. I'm one with you in the endeavor to ensure accountability of public officers and uphold public office as a public trust. Thank you very much, Mr. Senate President. Maraming salamat po.